So I'm very glad to be here at Pioneer Middle School, working with the students, producing documentary on obesity and overweight problems in our society, in our schools. It's a huge challenge. So
yeah, it is.
Tell me what you're focusing on, what you'd like to learn.
Well, we're focusing more on child obesity. So we'd like to have your intake on the topic of how it should be addressed in schools.
Sure.
And what needs to be done and what's already been done.
Well, I've worked a lot on this as superintendent of schools for California's 10,000 schools and over 6 million students. I consider this a top priority. I've created an organization called Team California for Healthy Kids so that we have more physical activity, more fun, engaging activities from hiking and biking to soccer to various kinds of games that we can get kids moving and have fun doing it, and better choices on food, having more salad bars in our schools, more fresh fruits and vegetables. I started out my career as a science biology teacher and nutrition teacher in high school level, and was able to find out with my students a lot of information. We had our own garden at the school. We had our own fresh fruit and some fresh vegetables that we grew. So this was fun, but at the same time we learned that there's an epidemic, a real crisis in healthcare. And a real crisis in healthcare means a crisis in the healthcare and financial systems. So about 1/3 of the children in California today are obese or overweight. And that's troublesome because they're not as healthy, they're not as alert. By and large, overall, students who are physically fit, who do well on the fitnessgram, who have a good diet, take care of themselves, do better in school by far. So there's a strong correlation between being healthy and doing well academically. So we want to encourage more physical activity. We have jogging clubs, again, soccer, walking and biking to school, weekend hikes, trying to get more students involved in these kinds of activities. As a science teacher and nutrition teacher, I know that the problem of obesity and being overweight leads also to diabetes, which is a very debilitating disease and costs billions and billions of dollars. So if we could reduce the amount of obesity and overweight student population, will reduce by billions the cost to all of us to pay for those medical bills. And so that's it's been a big focus of my years. I taught and also coached. I coached cross country and track, had 12 championships along many years of that coaching. But it was really about each student setting goals and improving themselves. So it wasn't about winning or losing as a team. It was how could you support each other as a team and then get students to set goals. So part of the solution is making the healthy choices the easy choices, so that we worked hard. As a senator, I worked hard to get soda pops out of the vending machines in schools. I was the author of legislation that banned trans fat from our school cafeteria meals and banned deep fried food from the cafeteria meals. So I've worked hard on this over many years. So it's a combination of changing laws in some cases, but making the healthy choices at school the easy choices. And then reaching out to parents. Students can reach out to their parents and say, hey mom, this may not be the healthiest, can you try this? And so we can take the message home so the other students, the other children in the family get the benefit of a changed diet that's better.
Yeah, I agree. So what do you think the state of California should do to help reduce the amount of obese people in this state?
Again, really focusing on messages and trying to get all schools to help have more active programs, have salad bars, have healthy connections to fruits and vegetables fresh from the farm field. I'm working with agricultural growers to bring the food directly to the school cafeterias. My Department of Education serves 6 million meals a day, and so we're changing the meals to be more tasty, more interesting, and nutritious for students. So if you provided good food that's good nutritionally, but it didn't taste good, it didn't look good, students aren't going to want to, enjoy it and use it. So we're changing from that level, and we have a campaign going, Team California for Healthy Kids, encouraging districts and schools to appoint a person to lead activities, to have more fun physical activities during the school day, after school, and then on the weekends too.
So, focusing more on child obesity, what do you think the main cause of child obesity is today?
Well, I think we have a couple of factors. One is we're more sedentary, we're not moving as much as we used to. So this is a problem. In some areas it's because it's not safe. So after school, as I was growing up, my brothers and I, when school was out, we would be able to go anywhere we wanted in the neighborhood, go out to the hills nearby. We weren't, there was no gang problem, drug problem. So safety is one issue. Also, there's a lot of advertising that encourages young people to eat junk food, basically. And so, that's a big thing to try to combat that. It's, the supersized meals, you get more calories than you need. So if you're not exercising as much and you're eating bigger sized portions, you're going to just keep putting it on pound after pound after pound and result in a big problem. Those are a couple of the big areas, yeah.
So
the other thing I'd mention is screen time. So sitting in front of screens a lot, whether it's Game Boy and other kinds of fun game screens, or whether it's TV, or even whether it's the computer. The computer is a great help in education, a great tool, but if it's game time and just sitting in a chair for hours, that's not as good as getting outdoors or getting moving.
Okay, so what do you think parents could do to help keep their kids fit?
Well, parents need to realize that they're totally influential. They're the first teachers, they're the first influence on students' lives. So we're hoping through our campaign and other initiatives to alert parents to the need for them to watch the diet in the house, to not have too many oversized meals, to not have too many helpings of food that's not nutritious. It's just empty calories. So I think there should be moderation in everything, and parents, instead of prohibiting all chips and all soda pops, have some kind of balance, but need to really provide a lot of healthy choices for students in the home.
Do you think that in some cases child obesity is the product of child abuse by their parents or others?
I wouldn't say that. I haven't seen any literature that suggests there's a strong correlation. I do think that parents in a fast-moving world with a long work week and heavy work schedule, there's less free time for parents to shop and prepare meals. And often you see this in the grocery store, the mom's trying to get through the line. She just came home from work, she has one or two of her kids with her, and the kids are saying, give me this, or can I take that? And so they to reward the kids or to keep them quiet as they're going through the shopping, they get the extra candy bar or cupcake or big muffin, and that's not a healthy trend. So parents need to be aware of that.
Yeah. What do you think the United States Congress could do to help reduce the amount of obese people in the nation?
They've done some good things recently by setting higher standards for nutritional content to the meals. I think they can provide more money because changing the standards is one thing, but sometimes the fresh fruits and vegetables cost more than some of the junk food alternatives. So Congress could help supply more dollars to the school meals programs.
How do schools affect obese children, either positively or negatively?
Well, to the degree that schools for years had the junk food, the soda pops in the vending machine and the junk food even in the cafeterias, that was bad. So the changes in law that I helped author as a senator with others have made a big difference in the schools, but they need to keep working on it.
Yeah, I agree.
You want to repeat that question too again one more time? I think I answered part of it, but not the whole question.
Okay. So, how do schools affect obese children, either positively
Right.
or negatively?
In the positive side, participating in efforts like Team California for Healthy Kids and the Salad Bar Challenge, we set a goal of getting 1,000 salad bars over the next 2 years. We're already having schools, 450 new schools bring salad bars in, and then my department trains the cafeteria staff on how to set it up right and make it look attractive and be tasteful and something students want to come back to. So those are some of the positive things we can do. Having water dispensers, you have schools where you have broken drinking fountains or gum in the drinking fountain, and you don't really want to drink water from that. But there's other schools now that are putting in water dispensers where and encouraging students to carry water bottles with them. So one of the preferred drinks of all is water. It's healthy and low calorie, no calorie.
Yeah.
So you can encourage these kind of habit-forming environmental activities at school where the easy choices are the healthy choices.
Yeah, I agree. Well, thank you for having.
Noah, thank you. Great questions, and glad you're tackling this very important topic. It's wasting billions and billions of dollars that go into healthcare as a result of obesity and the diabetes that comes along with it. Heart disease, all kinds of problems that lead to diabetes. This is bad. So we can help our students have healthier, fuller, energetic lives and do better in school and save billions of dollars at the same time. So you're on to something big. We got to deal with the obesity and overweight crisis. Thank you. Thanks, Noah.